What if I told you that there's a single exercise, no gym, no equipment required, that could help bring back the strength, stability, and confidence you may feel slipping away after turning 60? Most people aren't aware that once you hit 60, your body naturally starts losing about 1% of its muscle mass each year. Left unaddressed, this gradual loss can take away something deeply important: your independence. The alarming reality is that a single unexpected fall can completely alter your life. But here's the good news: a short series of just 5 gentle movements can help counter this decline. And it all begins with one motion you perform every day without even thinking: standing up from a chair. This seemingly small action is actually a strong indicator of how much strength and mobility you still have. Curious why this basic move could be the key to staying active, steady on your feet, and in control of your daily life? Let's get started with the first movement: the chair-assisted squat. This isn't just a physical exercise. It's a powerful indicator of independence and a critical tool to help maintain it. When you perform this motion, you're primarily engaging 2 key muscle groups: the quadriceps, located on the front of your thighs, which help in extending your knees, and the gluteal muscles, essential for hip movement and support. These muscles play a major role in everyday tasks, from standing up without help and walking confidently, to climbing stairs or getting in and out of vehicles with ease and balance. Scientific research in physical therapy and rehabilitation highlights that the ability to stand from a seated position without using your hands is strongly connected to better health outcomes, increased life expectancy, and a reduced risk of falling in older adults. In fact, the American Journal of Preventive Medicine reports that individuals who regularly practice chair squats tend to show notable gains in lower body strength, walking speed, and overall functional ability. As we get older, sedentary habits tend to increase, which sets off a damaging cycle. Less activity weakens the muscles, and weaker muscles reduce our ability to stay mobile. This is where the chair-assisted squat serves as a powerful solution. It's a simple, equipment-free exercise you can do virtually anywhere. And when done with proper form and control, it targets the muscle groups most affected by aging. One especially important benefit is the activation of type 2 muscle fibers, the fast-twitch fibers responsible for quick, strong movements. These fibers decline faster with age, so it's vital to keep them active, even through low-resistance movements like this. Evidence from the Journal of Geriatric Physical Therapy confirms that bodyweight exercises like chair squats can decrease fall risk in older adults by over 30% within just 12 weeks of consistent training. Beyond strength, this movement enhances dynamic balance, spatial awareness, and stability, all crucial for navigating uneven ground, avoiding trips, and reacting quickly to sudden changes in posture. By incorporating just 2 to 3 sets of 10 to 15 repetitions each day, this single exercise becomes a cornerstone for aging with strength, mobility, and independence. The second movement is the glute bridge, a safe yet highly effective exercise for older adults who want to build deep muscle strength without putting unnecessary pressure on their joints. The exercise is simple: lying on your back with your knees bent and feet planted on the floor. You lift your hips upward. This action engages multiple muscle groups at once: the gluteus maximus, the lower back muscles, and the deep core muscles, especially the transverse abdominis. Together, these form the core, which plays a vital role in maintaining balance, posture, and spinal support. With age, these muscles naturally weaken, often due to reduced activity and the gradual loss of muscle tissue. This decline increases the likelihood of falls, poor posture, and chronic discomfort, particularly in the lower back. From a scientific perspective, the glute bridge is more than just a strength exercise. It is a therapeutic movement. Research published in the Journal of Back revealed that older adults who participated in a 6-week program including the glute bridge reported less lower back pain and showed significant gains in core strength and endurance. By strengthening the glutes, this exercise helps shift mechanical loads away from the pelvis and spine, reducing pressure on the lumbar region. Improved glute strength also supports pelvic stability, which is essential for walking efficiently, climbing stairs with ease, and lifting objects without strain. Another advantage of the glute bridge is its accessibility. It requires no special equipment, can be performed on a simple mat at home, and is low impact, making it gentle on aging joints. Adding mindful breathing, inhaling as you lower your hips and exhaling as you lift, further enhances core engagement and improves neuromuscular control. both of which are critical for safe movement in later years. Performing this exercise 2 to 3 times a week, with 2 to 3 sets of 10 to 15 repetitions each session, can revive muscles that are often overlooked, allowing older adults to move more freely, maintain confidence, and live without the discomfort that often limits daily independence. The third movement in this routine is the side plank, one of the most functional and well-rounded exercises for developing a strong core. The core is not just your abs, it's a deep network of muscles. That includes the abdominals, lower back, glutes, and the muscles around the pelvis. Unlike the traditional front plank, the side plank specifically targets the oblique muscles, the diagonal bands along the sides of your abdomen. These muscles are essential for lateral stability, torso rotation, and keeping proper posture. With age, weakness in this area can often go unnoticed until it results in a sideways fall, which is one of the most dangerous types for older adults. By challenging your balance in a side-lying position, the side plank deeply engages the stabilizing muscles of the hips, abs, and spine. This not only improves balance but also sharpens neuromuscular coordination, the body's ability to react quickly and stay steady on uneven surfaces. Research found that isometric exercises like the side plank strengthen the obliques, enhance postural endurance, and help prevent falls. Many falls are not due to weak legs, but rather from poor control of the body's center of gravity during lateral steps or quick turns. An additional benefit of the side plank is its low strain on the lower back. When performed correctly, it encourages a neutral spine alignment, making it a safe option for those with mild back discomfort while still building strength. For maximum effect, position your forearm and the side of your foot firmly on the ground, keeping your body in a straight line from head to heels. Hold the position for 10 to 30 seconds on each side, repeating 2 to 3 times a day. Over time, this builds a stronger, more stable core without the joint stress of high-impact exercises. Incorporating the side plank into your regular routine not only guards against dangerous sideward falls but also improves posture, movement control, and overall confidence, all of which are vital for maintaining an active, independent lifestyle after 60. Our fourth movement is the lateral leg raise, a simple yet often overlooked exercise that deserves a place in every senior fitness routine. This motion involves lifting one leg out to the side while keeping your torso upright and steady. Its main purpose is to strengthen the gluteus medius, a deep muscle located on the outer side of the hip. Unlike the gluteus maximus, which is responsible for explosive strength and powerful hip extension, the gluteus medius plays a quieter but vital role. It keeps the pelvis stable with every single step you take. Without a strong gluteus medius, simple actions like stepping up onto a curb, sidestepping to avoid an obstacle, or regaining balance after a stumble can cause the pelvis to tilt and the body to sway, throwing off alignment. This imbalance forces other muscles, particularly in the lower back and knees, to compensate, increasing strain and, most importantly, raising the risk of falls. Scientifically, it's well documented that the gluteus medius is one of the first muscles to weaken with age, especially in people who lead sedentary lifestyles. Its gradual decline contributes to instability during walking, particularly side-to-side sway. Research published in the Journal of Geriatric Physical Therapy found that older adults with weak gluteus medius strength not only experienced greater lateral movement when walking but also scored lower on functional balance assessments. Another study revealed that adding targeted exercises like lateral leg raises to a workout plan can improve gait symmetry, enhance side-to-side stability, and reduce fall risk by over 25% in just 12 weeks. Strengthening this muscle is also crucial for preventing knee valgus, a condition where the knees collapse inward due to poor hip alignment. This misalignment can accelerate joint wear and trigger pain in the hips, knees, and even ankles. One of the best things about lateral leg raises is their versatility. They require no special equipment and can be adapted for different fitness levels. Beginners can start by lying on their side on a mat, lifting the top leg 30 to 45 degrees while keeping it straight and aligned with the torso. As strength improves, the exercise can be performed while standing, using a wall or chair for balance support. For an added challenge and more muscle activation, resistance bands can be placed around the ankles or knees. The key is to lift the leg slowly and with control, focusing on engaging the hip muscles rather than relying on momentum. Doing just 2 to 3 sets of 10 to 15 repetitions per leg 3 times a week, can lead to noticeable improvements in gait stability, muscle coordination, and overall posture, all of which are essential for maintaining independence and mobility later in life. The fifth and final movement is the child's pose, a gentle, restorative position that is accessible to people of all ages, yet particularly valuable for older adults. At first glance, it may seem like a simple resting posture. It involves sitting back on the heels, folding the torso forward, and either extending the arms in front or resting them alongside the body. But while it feels relaxing, its benefits go far beyond comfort. This calming stretch eases pressure along the spine, loosens the lower back muscles, and lengthens the neck, shoulders, hips, and knees. It's a position that encourages mindfulness, reduces stress, and most importantly for aging bodies, restores joint flexibility and improves overall body awareness. After the age of 60, tension often builds in areas such as the lower back, hips, and muscles along the spine. This is due to a combination of reduced movement, natural stiffness, and prolonged sitting. Child's pose acts as a physical and mental reset, giving the nervous system a chance to shift into a state of deep rest, while relieving tightness in joints, muscles, and connective tissues. From a physiological perspective, this posture provides gentle spinal traction, helping to decompress the intervertebral discs, a major benefit for older adults dealing with lower back pain, disc degeneration, or spinal stenosis. Studies published in Spine Journal and the Journal of Yoga have found that restorative positions like child's pose can lower cortisol levels, reduce blood pressure, and enhance parasympathetic nervous system activity. These changes not only ease physical tension but also reduce anxiety, improve sleep quality, and promote a greater sense of well-being. The posture also supports hip mobility, which is essential for walking confidently, maintaining stride length, and lifting the legs properly. The combination of hip flexion, thigh stretching, and abdominal relaxation keeps tissues flexible, improves circulation, and aids in muscle recovery after exercise. The importance of such exercises becomes even clearer when we look at the data. According to the Centers for Disease Control and Prevention, CDC, 1 in 4 adults over 65 experiences a fall each year, making falls the leading cause of traumatic injuries in this age group, many of which lead to hip fractures, long hospital stays, or permanent loss of independence. The most important thing to remember is this: the risk of losing balance and independence as you age is not something you have to accept. Research clearly shows that a well-structured home exercise program, like the one we've shared in this video, can reduce the risk of falls by up to 30% in as little as 12 weeks. Why does it work? Because it targets 4 essential areas that naturally decline with age. If left unstimulated: balance, functional strength, motor coordination, and body awareness. And here's the best part: you don't need a gym membership or expensive equipment. All it takes is consistent effort and a handful of well-chosen movements. But perhaps the most meaningful benefits aren't just physical. They're emotional. When you can stand up with ease, walk confidently, climb stairs without help, and enjoy time with your grandchildren without fatigue, something powerful happens. Your confidence returns, your self-esteem grows, you feel in control again, and that changes your life. Watch the full video to learn each movement, understand its benefits, and see the correct form. Then try them at your own pace, listening to your body and honoring your limits. It's not about perfection, it's about consistency. Even doing them 2 or 3 times a week will bring noticeable changes. But if you can work them into your daily routine, the benefits multiply. And you're not alone. Join our community right here. Share which exercise challenged you most, which one you enjoyed. We read every comment and use your feedback to create content that truly helps. If you found this video useful, tap like, subscribe, and turn on notifications so you don't miss our weekly tips for living with more balance, strength, and freedom.